You never thought it could happen to you or a family member. I mean, a couple days before the surgery, when you were in the doctor's office, he told you gallbladder surgery is easy. You'll be in and out of the hospital in a day or two. I'm only going to put 3 little holes in your belly and remove your gallbladder. So why were you hospitalized for weeks or months? Why are you having all these problems? Why do you have this huge scar across your belly? Hang on a few seconds. Grab a piece of paper. I am going to explain to you the 2 reasons why doctors commit medical malpractice when doing gallbladder surgery. I'm DiMartino. I'm a medical malpractice lawyer and author of A Patient's Guide to Medical Malpractice Claims. Ready? The first reason is this. When the doctor places the trocar or port into the belly, the first stick in the belly is blind. If they push the trocar or port too far down without looking through the camera on the end, or if they're not in the proper anatomical area, they can injure a blood vessel, usually the aorta, or an organ in the area. Now, the second reason they commit malpractice is a little more complicated, so bear with me. The gallbladder is a sac that hangs on the bottom of the liver, and it holds a digestive juice called bile. When we eat our pizza, the brain sends a signal down to the gallbladder and says, "Gallbladder, it's time for you to work. We need to digest this pizza." So the gallbladder squeezes and secretes this bile through a tube called the cystic duct, which meets up with another tube called the common bile duct, which takes the bile into the small intestine so it could mix with our pizza and digest the food. Now, what happens when the doctor removes the gallbladder, the doctor is supposed to cut the cystic duct and remove the gallbladder. But the doctor misidentifies and believes he's cutting the cystic duct, and he's actually cutting the common bile duct. Now, this causes a medical emergency. Many times these patients have to go through a rerouting of the small intestine so that bile is still able to flow from the liver down to the small intestine. So you're still able to digest your foods. If you have any questions about gallbladder malpractice, you can always give me a call, or you can shoot me an email, or you can click the link. It'll take you to my blog, which has a more in-depth article explaining gallbladder malpractice. I am DiMartino, meeting you at the intersection of law and medicine.